Hi, I'm Cindy. I'm the Program Director of the Respiratory Care Program here at St. Luke's College. Respiratory therapists work with people with breathing problems. So what we do here at the college is we train students to become competent and compassionate respiratory therapists.
I'm Ashley. I'm the clinical coordinator here at St. Luke's College for the Respiratory Care Program. We are the only respiratory care program on the western side of Iowa. We are in our clinical laboratory where we get to practice the skills that we learn before we apply it to patients.
So respiratory therapists, we work with patients of all ages and sizes. We work with adults, we work with pediatrics, and we work with babies. Now people have breathing difficulties, so this particular patient is having some shortness of breath, isn't able to catch their breath, and has deteriorated now, so he's having a lot of difficulty breathing. So Ashley is going to have to intubate. We're going to have to put a tube down his throat in order to help him breathe. So she is using a laryngoscope and guiding an endotracheal tube into his trachea to help him breathe. She's going to attach the manual resuscitator to the endotracheal tube, and as you can see, the lungs are starting to inflate. So Ashley would now put on a tube holder, attach that to the patient's face, and then hook them up to a ventilator. So we utilize ventilators, we bring them in here so the students who now practice this skill can then manage the ventilators and practice using a mannequin before they would actually take care of real patients. We also work with pediatric patients. So we work in the general care areas, we work in the critical care areas. So we might be giving them oxygen, we might be giving them breathing treatments, we may be placing them on ventilators too and helping manage those ventilators. We're also part of the resuscitation team in the neonatal intensive care. So our particular patient, this is a baby, it's a 30-week gestational baby, so it was born premature and it's having some difficulty breathing. So Ashley is manually ventilating this particular baby, and the baby's coloring, which is blue because it's not having enough oxygen, has now pinkened up, and now they're getting plenty of oxygen. So if the baby still was having some difficulty breathing, we would intubate just like Ashley did for the adult. We would, of course, use a smaller tube, and we would use a smaller laryngoscope in order to get that tube in. So our students have opportunities to practice on the mannequins, to learn those skills, so they become competent and confident and with those skills in order to truly do them on actual patients. So respiratory therapy, we are the quiet, unsung heroes. We are the frontline healthcare workers. Respiratory therapists, you need them when you can't catch your breath. So become a frontline healthcare hero, become a respiratory therapist.